Hi, I'm Kendall Smith, president of Seven Generations Medical. Seven Generations Medical specializes in First Nations healthcare. We are pleased to participate in this year's NSWOC National Conference and share some of the unique programs and services that we offer. Just a brief overview of what we will be covering in this presentation. About Seven Generations Medical, healthcare challenges for First Nations people, working with us, our forms, the 2021 wound care approved product lists with non-insured health benefits, and the 2021 ostomy approved product listings. A little bit about Seven Generations Medical. Seven Generations Medical was created to meet the needs of First Nations people living both on community and in urban settings. We do not deal with provincially funded programs such as ADL, the SAIL program, or ADP program. We deal exclusively through the non-insured health benefits program to meet the needs of First Nations people across Canada, primarily working in BC, Alberta, Saskatchewan, Manitoba, and Ontario. We specialize in ostomy and wound care. First Nations healthcare is not only our number one priority, it is 100% of everything that we do. Some of the challenges that face First Nation people. Access to healthcare. A lot of this is due to the remoteness of some of the communities. Getting clinical education for the community nurses. Knowledge of the non-insured health benefits program and the formulary. This is mostly around clinicians in an urban setting that really are not accessing the program on a regular basis and trying to keep up with the many changes of the program. And the biggest one that we hear about is the delay between clinical assessment and product delivery. And this varies between provinces, but is consistently between 3 or 4 weeks delay from the time the client is assessed until the products are delivered. What makes working with Seven Generations Medical unique? We ship directly to the community or individual in BC, Alberta, Saskatchewan, Manitoba, and Ontario, and usually can have the products delivered within 48 hours after receiving the order. We really value education, and whenever possible, we try to do at the community level, working with RNs, LPNs, and caregivers. Education is provided through NSWOCs. We assist healthcare professionals with simple order forms, and our knowledge of the NIHB formulary can greatly reduce delays. Our templates are easy to fill out, and we submit them directly to the non-insured health benefits program on the client's behalf. Products are shipped out the same day that orders are received. We are confident, from years of working with the program, that we will get approvals and see no reason to delay patient care. One of the challenges identified earlier was the delay between assessment and product delivery, sometimes being 3 to 4 weeks. We have that down usually to 2 to 3 days. This is an example of one of our order form templates, very simple to use. We will submit this directly to the non-insured health benefits program on the clinician and client's behalf. A few things to note on the right-hand side near the top, where it says status number. This sometimes will be referred to as band number or treaty number. And on the bottom, always make sure that the form is signed and dated. Underneath the note section, you can put diagnosis. In this example, it's a colostomy. And underneath is where you can write the product description. In this example, it's a Hollister flat flange, 50 every 3 months for a 1-year period. On the right-hand side is your wound status assessment table. This must be accompanied with every wound care order. The next form says Alberta Wound and Ostomy Form. It's the only form that's accepted in the province of Alberta. This particular form can be used with all the other provinces. A couple of the reasons we developed the previous template is on this form, there's actually no area to include client address and where to ship the product, but For Alberta, this is a form that they require, and you cannot process the prior approval unless it's done on this particular form. And again, like the previous template, if it is for wound care, the wound assessment form must accompany this. Next, we have a screenshot of the 2021 wound care approved product listings through non-insured health benefits. This is more for general information. These are not codes or anything that you will need when filling out the forms. This is when we receive your form, what we do, we code it appropriately and then send it in for prior approval. Just a couple things to bring to your attention, and I'll use the example on the very bottom left under alginates, where it says alginates, polyabsorbent fiber dressings, other. NAHB uses the category other in a lot of different places for foams, alginates, silvers, etc. This, if you don't see your size listed, as in a heel dressing, a sacral dressing, or some of the larger size dressings, they all get coded as other. So if you're reviewing this list and you don't see the specific dressing you're looking for, just be assured that it will fall under the other and we'll have approval for that. 2021 wound care products continued. You'll see the specific sizes of foam dressings at the top, and then of course the other category that we just mentioned earlier, all your different sizes of gauze dressings, packing strips, and your gels, and of course on the bottom, your gels other. Page 3 of the 2021 wound care products. Couple things of note. At the very top, you'll see honey dressings. This is all shapes and configurations of honey. As an example, this would be Medi honey, would come under that category. Moving down towards the bottom is your iodine dressings. This would be your iodosorbs and your inidines. And then on the far right is all the different sizes of your non-adherents, impregnated and non-impregnated. The last page of the 2021 wound care approved product listings. At the very top are the codes for silvers. There's your silver alginate dressings in all the different shapes and configurations. And at the bottom of this silver is the other category. This is your Actisorbs, your Acticoats, your Biotane Mepilex AGs in all the different shapes and sizes. And most of the silver dressing orders are coded under the other category. On the far right, you'll just see the general product listings. This is just good information to know. Items such as dressing trays, vinyl gloves, and sterile saline are covered by the program. This slide, once again, is a screenshot of the non-insured health benefits program formulary, this time of the ostomy products. A few things to note. The ordering cycle for non-insured health benefits is done every 3 months. A lot of the provincial programs like ADL, SAIL, etc. are 2-month cycles. Non-insured health benefits is 3. On the right-hand side, this is actually a really good part of the program. You'll notice where it says closed-end pouches, 2-piece, and drainable pouches, 2-piece. The non-insured health benefits program does not make a patient choose between one or the other, and they actually approve both closed-end and drainable at the same time. If you go down a couple lines, you will see where it says 2-piece system convex. It's interesting to note that there is no extended wear convexity covered through the non-insured health benefits program. However, at 7Gen Medical, we will always fill whatever is scripted by the clinician. So if you are requesting an extended wear convex flange, we will supply exactly what you request at no charge to the client. The last page of the approved product list for ostomy. 2 things to note. On the bottom left, you will see moldable ring seals. This is the category for your Adapt rings, your Brava rings, your Ekin seals. And you'll notice that there is no quantity indicated on the right-hand side. What the program allows is one ring seal for every change in flange. So if you're ordering 50 flanges, you'll also be able to get 50 of the rings. On the top right-hand side, it says protective skin wipes spray. I only point this out because if you notice on the right, the quantity limits, you are only allowed 4 per year. So this would be 4 boxes, or this would be 4 bottles of the spray. On behalf of 7 Generation Medical, I hope you found this presentation valuable. If there's any further information required, please go to our website at 7genmedical.com or feel free to reach out to us with our 1-800 number, 1-833-743-6633. Thank you very much for your time, and I hope everyone enjoys the rest of the 40th annual conference.